My name is Gilbert Habib. I am president of the EACVI, which is the European Association of Cardiovascular Imaging, and one of the main activity of this big association of the European Society of Cardiology is based on research and innovation. It is my pleasure today to discuss with my colleague Erwan Donal and to ask him the first question. Erwan is chair of the Committee on Research and Innovation. And Erwan, so what's new in the EACVI on research and innovation?
Thank you. We are trying to solve simple and more complicated issues. For instance, we did the NOR study about the normal values in echo, but we are also trying to solve an issue which is very important for the clinician, which is the real value of the E over E prime ratio. And of course, we are also trying to do multimodality studies, and we try also to solve more complicated issues like imaging in CRT.
So this is very important, but how can you find a place for the national societies in your research projects, particularly in the field of multimodality imaging, since we are a multimodality imaging association?
Yes, that's an important issue actually, because we want to work with the national societies and we want to work with everybody. And we have the chance 1 year ago to start a large European project about the consequences of chemotherapy in breast cancer. And this project is done in association with EORP, and we can involve each individual countries in this project. And we also have another project about endocarditis. And from my side, can you just explain in a few seconds which is the most important message of the new guidelines about endocarditis?
Yes, yesterday we presented these new guidelines of the management of infective endocarditis, and the main messages are several. But the first is that prevention is unchanged, and we keep prevention for high-risk patients with high-risk procedure. And second, probably the two most important new messages are first the notion of endocarditis team, which is introduced for the first time in the guidelines, and also the fact that new imaging techniques are included in the diagnostic algorithm, and we proposed for the first time a new diagnostic algorithm for the diagnosis of infective endocarditis, and also a new diagnostic criteria for endocarditis. Oh, thank you for all these beautiful projects you have within the EACVI. And my conclusion is that really we have several projects, and we have a big association and fascinating project, and very important to involve the national societies in the future.
Join us.
Thank you very much.